Namaskar dosto, good evening friends. I am Dr. Sanjay Kalra, your friendly and familiar endocrinologist, and you are watching Dr. KK's Med Talks, Mondays with Dr. Sanjay Kalra. आज के हमारे नॉन स्टॉप शो का 845th 845वां एपिसोड है. Let's have the headlines for today. Three out of every four Indians, हर चार में से तीन, 3 out of every 4 Indians suffer from vitamin D deficiency. ये तो बहुत हाई नंबर है, हाई बड़ा आंकड़ा है. एंड यंग एडल्ट्स बिलो द एज ऑफ 25 आर द मोस्ट अफेक्टेड. तो जो हमारे मोस्ट प्रोडक्टिव किशोर अवस्था वाले लोग हैं या यंग एडल्ट्स हैं, दे आर द मोस्ट अफेक्टेड. 79% of men overall and 75% of women overall have lower than desirable vitamin D levels in their bodies. And a national study has shown that Delhi NCR has the lowest incidence of vitamin D deficiency. Arre wah, chhage, and we acknowledge all the questions about the weather in NCR and also about vitamin D deficiency. So while Delhi NCR has the lowest incidence of vitamin D deficiency, Baroda and Surat in Gujarat have the highest incidence. तो इसके बारे में भी जानते हैं ऐसा क्यों हो रहा है. And vitamin D, of course, has been found by researchers to help in preventing bone deformities such as rickets in children and bone pain. The name is osteomalacia in adults. इस सब न्यूज़ के बाद let's go to our topic for today. Vitamin D and bone health. For the past couple of months, we have been doing a series on vitamin D, various aspects of vitamin D and health. आज हम बात करेंगे हड्डियों की, bone health की, जोड़ों की. And our guest for today is someone who is famous, acclaimed all across the country and beyond. Warm welcome, Professor Rajesh Malhotra.
Thank you. Thank you so much, Dr. Sanjay.
Namaskar, Dr. Saab, and welcome to our show. Professor Malhotra is Professor and Head of the Department of Orthopedics. He is also Chief of the JPN Apex Trauma Center at AIIMS New Delhi. He is an alumnus of AIIMS New Delhi, and he has also served as President of the Indian Orthopedic Association from 2018 to 19. He runs the only cadaveric bone bank in India at AIIMS. Dr. Saab, warm welcome to the show. हमारे साथ लोग लॉग्ड इन हैं फ्रॉम अक्रॉस द कंट्री एंड खूब सारी डिस्कशंस चल रही थी. आई अपोलोजाइज टू एवरीबॉडी, हम थोड़ा सा लेट हो गए. विनय गुप्ता जी आपको नमस्कार कर रहे हैं. ही सेज विटामिन डी इज अ बर्निंग टॉपिक. व्हाई इज इट सो इम्पोर्टेंट, सर? व्हाट इज सो इम्पोर्टेंट अबाउट विटामिन डी?
So I was hoping to cover some of these things in my talk, but then I think I would not like to delay answering your question. So vitamin D is being recognized more and more as what I would call the wonder vitamin. So it has got so many functions beyond bone and joints and muscles, and which is actually also quite intuitive, because we tend to think of a system as an independent system: bone, joint, muscles, nerves to move them. So people have called it MON, muscle, osteo, arthro, and neuro. But then actually, if you look at the body in totality, all system disorders more or less are interdependent on each other. For example, you have diabetes, or you have anemia, or you have lymphoma, or whatever you have. The impact is seen on a lot many other systems also. Similarly, the vitamin D, for example, is activated in so many systems outside the bony system, say in prostate, in colon. So the nature knew that there is a certain interdependence. So you imagine that the hormone controlling the bone is actually being activated in liver and then in kidney, or there is the same enzyme is present in, like I said, prostate and colon. So that is one thing. The second thing is that the second thing is that the the extra skeletal benefits of the vitamin D, which are known, and which are, on so many other body systems. And we know that even the cancers, it may have autoimmune diseases, and the things like COVID. We saw people who had low vitamin D levels in COVID had a higher mortality and more severe disease. So I think I'm an orthopedic surgeon. We'll talk about the bone and muscle and joints on whatever impact of the vitamin D on the body. But then I do thought it is prudent that you should know that it may actually even make a difference to the survival, as we saw in the COVID.
And sir, you're right. Actually, last year the Nobel Prize was won by Aspect, Closser, and Zeilinger, and they won the prize for quantum entanglement. What they show
Yeah,
is that two subatomic particles situated, miles and miles apart, millions of miles apart, can interact with each other. So if two particles can interact with each other, two inanimate particles, then why can't our hormones interact with each other? Sir, greetings to
absolutely.
you from across the country, and everyone is looking forward to listening to you, learning from you. You are famous across India as a teacher par excellence, and we'd like you to present some slides, please, and then we can take up all the questions which are piling up.
Sure. So I thought that, presenting the talk actually answers many questions.
Most of the
So
questions,
not,
correct?
and we can use that the remaining time for the answers which have the questions which have been left unanswered. So I'll start with the screen share, and I'll just start with my slides. And so this is essentially a talk on vitamin D and bone health. So, like I said, we wonder whether it's a wonder cure. But just now, as the Dr. Kalra had set the stage, at least 70% of Indians are deficient in vitamin D, and 15% are insufficient. That makes a total of 85%. And we deal with hip fractures, and I'll tell you why it happens. When we get an old patient with a hip fracture, I think they are it's almost a universal truth that all of them have a vitamin D deficiency. So much so that all over the world, they initially used to measure vitamin D levels in hip fracture patients. They've stopped doing that because everybody who comes with a hip fracture is vitamin D deficient. And you have to just start treatment for the vitamin D deficiency as you are starting the patient preparation for the surgery of the hip fracture. And how this has been increasing, the people with compromised bone, osteopenic or osteoporotic, from 26 million in 2003 to double the number, that 50 million in 2015. And Asia is going to bear the brunt of this because most of the population of the world lives in India and China. So this was briefly mentioned by Dr. Kara that it varies from city to city, and maybe we can look at some of the reasons. Average is 80% across India, and in PGI, 50% of the patients who had no symptoms during a routine checkup were found to have vitamin D deficiency. 90% of patients do complain of back pain, unexplained muscle soreness, or even general fatigue. And the 96.7% of vitamin D deficiency in Asian Indian patients, fragility hip fracture. And I can tell you the rest also would be insufficient, not sufficient, because of the reasons which I'm going to tell you later on. So it's a pandemic. It's actually universal. It's across the Western world, and also, although the India doesn't top the list of countries with osteoporosis, but vitamin D deficiency, in spite of the ample sunshine, is very common in India. And this is some of the reasons which are seen here. So one is the dark skin. So, you need 10 times more sun to produce the same amount of vitamin D as most Europeans. And interestingly, when we calculate the dose of sunlight to make vitamin D, we measure it in terms of how much of sunlight causes erythema. And that erythema is actually something you can see on a like Gora skin, or a Caucasian or a European. Imagine if I sit in the sun, how much difficult it will be for you to see when I'm getting erythema because of the sunlight, to know that how much of vitamin D I have formed. The age and longevity. Now, age, I earlier mentioned also earlier also mentioned that people with hip fracture, they come with almost minimal levels of vitamin D, because you see they are very often vegetarian. They have, the wrinkling of the skin, which means that the cholesterol under the skin is now gone. And the vitamin D is not a magic to produce vitamin D through the exposure. Actually, it is the cholesterol under your skin which gets converted to vitamin D precursor or vitamin or cholecalciferol in the by the ultraviolet light B. Now, when you have a skin which is old and inefficient, when you have no cholesterol under the skin, and when you have no exposure to sunlight because you don't go out, and when your intestines are poor at absorbing the calcium and vitamin D which is given orally, you are bound to get vitamin D deficient. Also, the distance from equator matter. The further away you are from the vitamin D, the less is the vitamin D production, and less is also the hazard because of the excess sunlight exposure, like skin cancers and all. People spend less time outdoors now. That's a big problem. Body weight. Now, I tell you something very interesting. When you are fat, you are supposed, particularly in ladies, you are supposed to be protected against the osteoporosis, because you are overweight, so your bones bear more weight, so they are actually healthier and stronger than the women who have more fat in the subcutaneous location, are able to convert more of estrogen to its active form, which occurs in the fat. So they are more estrogen replete, and that's why they have less of osteoporosis. And then above that, if they fall, they have a cushion, so they don't break the bones. So osteoporotic burden is always more in thin, lean, underweight ladies who have no fat under the skin, who easily break the bones when they fall. However, when we do knee replacement on these fat ladies, because they wear out their knee joints very early, we find that sometimes the bones are so weak that the even putting by the pressure by the thumb can indent the bone. It can be so weak around the knee. And the reason for that is that, surprising it may sound, but the fat and obese and morbidly obese patients are actually malnourished. And they often, particularly in the West, they drink a lot of colas and sodas, which also interfere with the bone health. So body weight is a problem. Sedentary job, of course, is a problem, because to keep your bones strong, you have to put weight on it. And it has been shown that people who are having work indoors, obviously they are having less sun exposure, so they again have the low vitamin D levels. So even in obese patients, the vitamin D levels are very low. And then, in if you are vegetarian, then you are in big trouble, because there are really no vegetarian sources of cholecalciferol. You can get some ergocalciferol from the plant sources. And we know that when we were young, our father used to get us shark liver oil, sharkoferol. So that used to be a very rich source of the omega 3 fatty acids which you get in capsules now, and vitamin D, because vitamin D is stored in liver. And this shark liver oil, so called, used to be, or sharkoferol it was called, was very rich source of iron and omega 3 fatty acids and vitamin D, etc. Now, we have you have heard from Dr. Kalra that the impact of vitamin D deficiency can be on rickets. It can lead to osteoporosis, osteomalacia in children, cardiovascular disease, diabetes, cancer. I just mentioned about cancer, the infections such as tuberculosis, and I just mentioned how in COVID you got more severe disease, and it's explainable. Is explainable by the fact that we are recognizing now the effects of vitamin D on immunity. And that is actually a very major impact which can help you fight infections. So this is another example where the factors like pollution, the how much of skin is exposed, the dark skin come into play, wherein despite exposure to sunlight for 30 minutes every day for 30 days during summer and winter, children in the age group of 10 to 15 years did not achieve the D levels considered adequate for sound bone health. So being out in the sun is not enough. And then you have to be exposed continuously for at least 30 to 45 minutes in the sun with your face, neck, upper part of the trunk, and upper part of the arms exposed continuously. Because if you are in sunlight for 15 minutes and you go indoor for 10 minutes and you come back again, probably the chain is interrupted. The metabolites which were halfway into forming vitamin D have already been washed away, and you'll have to start all over again. And one interesting thing I like to tell is that the hours when your shadow is shorter than your height are the hours when sunlight is most effective at making vitamin D in your body. So remember that, but then it has to be exposed to the areas of the skin which are most efficient at synthesizing vitamin D. That's the key. So we know vitamin D is a secosteroid hormone. It's essential for calcium absorption and bone mineralization, positively associated with bone mineral density. And prolonged and severe vitamin D deficiency leads to rickets and osteomalacia, something which is very basic. We teach the undergraduates, but there can be many other effects. So this is how it happens, whether because from the diet or from ultraviolet B, you get vitamin D. The T half life is 24 hours. It first goes into the circulation, goes to the liver, gets converted to a pro hormone, which is a 25 hydroxy vitamin D, which has a very long half life of 3 weeks. And then it can actually undergo endothelial stabilization. It can go to it can go get into placenta and brain through magellan, and it goes to the milk, and then in the breast, colon, skin, ovary, prostate, etc. This is actually it converts it into 25 hydroxylase. So it gets converted into 125 dihydroxy vitamin D, either in the kidney or in these organs, because these organs also express some amount of 1 alpha hydroxylase. So the active hormones are synthesized, which is 125 dihydroxy vitamin D, which has a half life of just 2 hours. And then this has got its endocrine function, bone health function, and of course, the effect on the intestine to give rise to absorption of the vitamin D. So in a balanced system, the calcium absorption meets the metabolic demand. So there is an axis between the calcium, the vitamin D, and the parathyroid hormone. See, calcium is one of the most important ions or elements which is needed in the body. You need it for muscle contraction, you need it for cardiac activity, you need it for brain. The low calcium can cause tetany, it can cause convulsions, it can cause effects on the heart. So you are alive because of adequate levels of vitamin D, and that levels of vitamin D have to be maintained. So when you have dietary calcium, this vitamin D will help absorption of this calcium from the gut. And then, in vitamin D deficiency state, the calcium is not absorbed, so the calcium becomes low. So then the parathyroid comes into action. So what it does is it tries to reabsorb calcium from the kidney so that less the calcium is not excreted out at all. In lieu of that, it excretes more of phosphate, and then it actually mobilizes the calcium from the bone. You would have heard that bones have many functions like supporting your structure, giving attachment to the muscles, making joints, keeping you upright, everything. But one of the functions of the bone is it is a store for calcium. So anytime you need calcium for vital body functions and there's not enough coming from outside, this parathyroid hormone is going to move it. And that's why, if you know, in a condition like hyperparathyroidism, the bones become so weak that they start breaking spontaneously, or also, the structural strength of the bone decreases. So, vitamin D in bone health is very important because vitamin D deficiency leads to bone demineralization, like I told you, decreased calcium absorption, and then the levels have to be maintained. The continuous bone turnover and resorption weakens the architecture, because what happens is there's something called bone turnover, which means that bone is not dead, it's not static, it's continuously getting resorbed and continuously getting formed. Now, why it is required is that if there is a damage to the bone, to repair it, so if there's a crack, then army of osteoclasts will come and it will dig out a hole, and then the army of osteoblasts will come, which will fill up that hole. So these bone remodeling cycle is constantly rejuvenating the bone, repairing the damage, and working there. Now, when the problem is that the bone, the resorption takes 3 weeks, and the bone formation takes 3 months, then it sounds quite dismal. It means we should just be having our bones falling off. Fortunately, this occurs only in the cancellous bone. So in cancellous bone, 80% of the remodeling takes place in the cancellous bone, 20% in the cortical bone. And fortunately for us, 80% of our bones are cortical and 20% are cancellous. So that's why when this thing occurs, when the bone remodeling increases at the time of menopause or because of hyperparathyroidism, the bones which have got mainly cancellous bone, they get affected most. So you start getting spine compression fractures, and you start getting the wrist fractures, wherever the metaphyseal fractures of the proximal humerus, lower end of tibia. The hip neck, the femoral neck has got 50% cortical, 50% cancellous. So it gets affected a little late. So this is what happens. So there is a direct relationship between the bone mineral density and the fracture risk, because the bone mineral density reduction is not only showing you a quantitative reduction in bone, but also qualitative, where the quality of the bone also becomes poor. So, and then it is an increased risk of fractures. So, this we have already covered. The other thing is that vitamin D deficiency leads to sarcopenia. Now, sarcopenia is loss of skeletal muscle, which occurs in old people. When you see some people who are old, they have hardly any muscle left. That can actually be categorized by the speed at which you walk or your grip strength. And you have when you have sarcopenia, you have a higher risk of falling and fracturing. And vitamin D deficiency causes loss of skeletal muscle mass and strength. And then these things are further aggravated by disability, hospitalization, and sarcopenia can lead to death by causing fall and a fracture. Vitamin D prevents falls in elderly. It is known falling is a marker of poor health and declining function. So, when we often say that a hip fracture is a sign of failing physiology, that's why we call it hip attack, and it can actually lead to death. And that fall is also the risk is aggravated by vitamin D deficiency. So you need to prevent falls, to prevent fractures, and to reduce morbidity and mortality. And vitamin D supplementation can do it all. So we know that deficiency causes muscle weakness, fall. The vitamin D receptors are expressed in skeletal muscles and myoblast cells. And when you have this resistance to vitamin D receptor, those are the grounds for developing autoimmune diseases and certain cancers and all those things which I told you. And even infertility. I was told that vitamin D has been discussed in many contexts. So one context is also that vitamin D deficiency can lead to infertility, or people have shown higher success rates of IVF when vitamin D levels are good. So vitamin D can increase protein synthesis and cellular growth in muscle cells, increase in the size and number of type 2 muscle fibers. And then, of course, the vitamin D deficiency can give rise to low back pain, chronic fatigue, ankylosing spondylitis, renal osteodystrophy. And this is what I briefly mentioned, that muscles, bones, joints, and nerves, they don't exist independently. They are as a single entity. So you have a neurological problem, you can fall. You have a joint problem, you can fall. You have bones are weak, you can break them and fall, and your muscles are weak, you can fall. So it's all continuum. And then there are certain extraskeletal benefits, like I said, that autoimmune diseases, because vitamin D is a potent modulator of immune system, and it reduces the risk of diabetes. The lower levels are seen in rheumatoid arthritis. It has a protective role in certain tissues, and certain deficiency in certain organs, like mentioned here, can give rise to cancer in these. And then of infectious diseases such as tuberculosis and upper respiratory tract infection and influenza are seen with vitamin D deficiency. Heart disease is, when you have low vitamin D, there's a 60% higher risk of heart disease than high concentration. I may add a word of caution here. If you have very high levels of vitamin D, some people have demonstrated FGF23 levels rise, so that can actually predispose to cardiac disease. So too much of calcium or too much of vitamin D also must be avoided. The patients with acute myocardial or infarction show low vitamin D levels. Type 2 diabetes mellitus risk is increased in vitamin D deficiency. And if you if you give vitamin D supplementation, you can actually blunt the rise of plasma glucose, and the progression and development of type 2 diabetes has been also reduced by the use of vitamin D. Obesity, vitamin D is inversely associated with body mass index, waist circumference, body fat, but positively associated with age, lean body mass, and vitamin D intake, possibly also because of its effect on muscles. Then, of course, vitamin D deficiency can give rise to depression or recovery from depression. And so, vitamin D supplementation is vital for treatment of depression. Parkinson's disease associated with vitamin D deficiencies, it can be used there. And the lower vitamin D have also been associated with increased risk of suicide. There are a lot of studies, just to highlight the point which I told you. This one is about the diabetes and for cancer. Suffice to say that one must recognize and understand the impact of vitamin D on multiple organs, and including the risk of cardiovascular, although there is no risk of cerebrovascular disease by high levels of vitamin D and calcium. But cardiovascular, I said, there's a fine balance. Deficiency as well as the very high levels, both are not good for your cardiovascular system. And then, of course, the vitamin D reduces the risk of a fracture. So optimal vitamin D status is essential when we are treating deficiency. We give 60,000 international units once a week. Although there are several parameters, but I think 20 nanogram per ml, if you have, that is equivalent to 50 nanomoles per ml, is the right level, which is enough, sufficient. Although you will find in Western literature, sometimes people give very high levels. There is very little role of calcitriol because it's expensive and it causes hypercalcemia. And you need it only when you have impaired kidney or parathyroid glands, particularly if your body is not able to convert cholecalciferol to 125 dihydroxy vitamin D, then only you need it. And this is about the daily supplementation by the ICMR, or National Institute of Nutrition guidelines in 2020. And you see most of them say about 600 international units per day and 800 international units per day for elderly because their absorption capacity is reduced. This is one simple algorithm. So if somebody is asymptomatic and vitamin D sufficient, you just need to take diet adequate in calcium and vitamin D and sunlight exposure outdoor. However, if you have symptoms and with vitamin D insufficiency, or if you have deficiency, then you need to actually do medical optimizations. You can give calcium as per RDA, and then you give 60,000 units per once a week for 8 weeks in case of insufficiency and 12 weeks in case of deficiency. And then you look at the clinical and biochemical response. If it is satisfactory, you maintain it with 60,000 international units once a month. Or if it is unsatisfactory, you can repeat 60,000 units and again for 8 weeks, once a week for 8 weeks, and reassess. One word here, this is very convenient that you tell the patient that you have to take it once a month. But the problem is that most studies are now showing that the daily supplementation of say 2,000 international units or 1,000 international units, depending on how what the status is, safe would be to take. Even 2,000 is, there is absolutely no problem. It will not lead you to toxicity. But a daily dose is much better than a monthly dose. We give monthly dose so that there's compliance, and sometimes in order to reduce the pill burden if the elderly people are taking too many too many medicines. So vitamin D plays an essential role in maintaining a healthy mineralized skeleton. Sunlight produces vitamin 3 in D3 in the skin. Then it further is metabolized sequentially to its active form, passing through liver and kidney. And insufficiency and deficiency are major cause of metabolic disease. And then a dose of 60,000 international units per week is recommended for the start of treatment in people with vitamin D deficiency for 12 weeks and for insufficiency for 8 weeks. Thank you very much for your attention, and I would be very happy to answer any questions which you have.
Uh, Thank you, sir. A wonderful presentation, and lots and lots of comments and questions coming from across the country. One question from Delhi NCR for you. It's been raining so much in Delhi NCR. The AQI has improved, the air quality has improved. So, what impact does that have on vitamin D status, sir?
So that's a great question, and I should have mentioned it when I was talking about when you said why it is different in different states. It was coming to my mind that AQI or the pollution has a major influence on how much of UVB reaches your skin. So pollution interferes with the efficacy of exposure which you are getting in order to synthesize the vitamin D. So definitely, we may have some nice days ahead and some better vitamin D production in the skin with the rainfall.
Sunny Grover is a leading personality of Karnal, Haryana, and he says, "I am outside most of the time. I am outdoors." This point
I
that you
understand his
mentioned,
name is Sunny.
hmm, Sunny. That's right. So he is Sunny. Yes, and he actually lives up to his name. He is outdoors most of the time. He appreciates this comment that you made about the shadow being shorter than the height. That's the time to be out. But if you're fully clothed, like usually he's in a t-shirt or in a full sleeve shirt, then is the vitamin D production enough, even if he's outdoor all the time?
No, it's not. Actually, the best thing would be, the best way to make vitamin D will be possibly sitting on the beach. For men, in their trunks with their back exposed. In fact, that's where the erythema is seen when you are getting the sun exposure. But then, well, if you are clad in clothes, if you have applied a sunscreen, or if you are exposed to sunlight which is coming through the window glass, they are all ineffective. In fact, something which I didn't totally agree with, but I think it's time to remember, he was a very good friend. Dr. K.K. Agarwal used to say that if you sit in, say, bath in Ganges, and he used to call it Shahi Snan. So
Hmm.
if many people would, when they want to take bathe in the holy river, they would just, sit there with the trunk exposed outside the water and sit there and do their prayers and all. The only difference is that he used to emphasize that it is done in the early hours of the day or early morning, and we know that that is time. Maybe you need longer exposure to make enough vitamin D, because that time of the UVB is not at its best for reaching you.
There is a question. Let me take this. What ideal vitamin D level? What is the ideal vitamin D level for optimum intestinal calcium absorption? So that is
So,
actually the role
so
of vitamin
like
D.
I
Yeah.
said, this is what I just mentioned during my talk was the IOM, the Institute of Medicine from US. There are different levels. Some people have gone to very high levels. I think we all agree and that 20 nanogram per ml or 50 nanomoles is good enough. And because you should not aim for very high levels for Indian population. It has been shown that the 20 nanogram per ml of 50 nanomoles is good enough. So earlier we used to say 30, that used to come to 75 nanomoles. Some people still persist with that. But I personally think that if you have 20 nanogram, and I have sought a lot of opinions from Indian scientists and experts, and most people would agree 20 nanogram per ml. A minority would say 30 nanogram per ml. But again, be very careful when you read the vitamin D report, because the nanogram and nanomole, they are different. The nanomoles are 2.5 times. It's just like 1 microgram of vitamin D is 40 international units. So you should not confuse. If you are saying, say, 400 international units of vitamin D, so it would be 10 micrograms only, right? So don't confuse the units. So the units, nanogram, 1 nanogram of 125 hydroxy vitamin D is 2.5 uh, international nanomoles of vitamin D, 125 hydroxy vitamin D. So
Like you spoke
20
of,
and 50
yeah.
or 30 and 75, but 20 is good enough. I wouldn't worry about you if you have 20 nanograms.
Dr. Vipin Bhandula is a civil surgeon from Kangra in Himachal Pradesh. So along with the Shahi Snan, he shares another best practice, which is Surya Namaskar, which everyone should learn.
That's very true. It has lot many other benefits also. The only problem is that when your shadow is shorter than your height, you will be sweating it out before you start making vitamin D. So that's the problem in most of the time. That time is not a good time for exercise for Surya Namaskar or this thing. But then, of course, these are things which are proven value for overall well-being and good health.
Sir, you are a surgeon and you operate on bones. How frequent is it in the operating theater that you open up a patient, you see the bone, you feel the bone, and you can just make out that it is so frail, there is no vitamin D, no calcium in it? How frequent
So
is
that
that in
is
your practice?
that assessment starts, when you look at a patient. If you
Yeah.
have a 90-year-old frail lady grandmother who has come with a fracture, this lady is 100% she's vegetarian. She's not going out. Her muscles are weak. Her nutrition is poor. She's got no fat under the skin. Her intestines are, not very efficient at absorbing. So worldwide, they are just started on supplementation. So that is one thing. Then, of course, like I said, the very obese people are also vitamin D deficient. But then, when we look at the X-ray of a fracture, if we see comminution, then we know that this is a patient who has got severe osteoporosis, which may or may not be coexisting with vitamin D deficiency, but more often than not, they are. So it's a mix of osteomalacia and osteoporosis. It's very rarely purely osteoporosis. So, but like I said, if you're doing a knee replacement, we see, I'll give you a classical example. A rheumatoid lady, she's got deformities, bad deformities. Her soft tissues are contracted and scarred. And when you're doing knee replacement in them, if you're not very careful and the structures, the soft tissues are tight, the bone will break before the soft tissue gets stretched. It will pull off a piece of bone. So weak is the bone that the scar tissue around the bone is stronger than the bone. And like I said, sometimes you can just push your thumb into the cancellous bone and it forms a print. Then, when you are trying to pass some screws in the bone, you can feel that you're not getting any hold. And like surgeons always have some tricks up their sleeve. So, in those desperate situations, we actually take some bone cement and the drill holes which we have made where the holes are screws are loose. We just take some bone cement, quickly put it into the holes which have been pre-drilled, and put these screws so that that bone cement will catch and keep the screw in place. Also, we have very special implants which I'll call the locking implants. So the screws get locked into the plate, so the screw cannot pull out. Even if it has got no purchase on the bone, you have this screw which cannot pull out and it will stay in the bone. And particularly if there are several such screws, each one going in a different direction, it is very difficult to pull the plate out. And very more often than not, we get success in getting healing of these fractures. But olden times when we didn't have these modern implants, it was a big challenge.
Follow-up question, sir. You've mentioned such a wide spectrum of diseases. So, are there any orthopedic disorders, any bone disorders, which require a relatively higher vitamin D level in the blood? जैसे डायबिटीज में वी हैव अ पर्सन सेंटर्ड अप्रोच टू टारगेट्स, किसी की ग्लूकोज हम 100 रखना चाहेंगे, किसी की 150. तो ऐसे विटामिन डी के लिए आर देयर एनी ऑर्थोपेडिक डिजीजेस वेयर यू वुड वांट अ रिलेटिवली हायर विटामिन डी लेवल?
Frankly, no. I don't think that the higher doses have any benefit for musculoskeletal system, but there are certain groups which are talking about giving ultra high doses of vitamin D. But those groups are talking about the immune modular functions of the vitamin D or autoimmune diseases or keeping they mention things like 100 international units per kg, from there to 1000 international units per kg, but they are for immunity. And these groups believe that there's nothing called vitamin D toxicity, which I don't totally agree with. But I do agree that it is very difficult to get toxicity of vitamin D by oral vitamin D. You can only get it by parenteral. But to answer your question, I'm not aware of any studies which have shown that a higher level of vitamin D has got better or more pronounced effects on the musculoskeletal system.
Maybe this is work for our endocrine colleagues. When we speak
Sure,
of person-centered
absolutely,
targets in thyroid, diabetes, obesity, so then we should think of
absolutely,
that in vitamin D as well.
absolutely.
Sir, many questions coming up, and it's nearly 8 p.m. already. Dr. Roshan says, does playing outdoor sports help in improving vitamin D levels? Would you encourage that for the
Absolutely.
entire country?
Yeah, but not in the evening and night, not in the night, day and night match.
Yes.
When it starts in the evening, yes, playing outdoors will help. But then you must remember that the vitamin D is synthesized for face, like I said, neck, upper part of the trunk, upper part, front and back, upper part of the arms. So you have to be dressed appropriately if you want to do that. But the playing outdoors, whatever games, racket sports or the volleyball or basketball, whatever you are playing, they are anyway good for your bone health. They are good for your muscles. They are good for your balance. So that is always swimming is an excellent sport
Exercise.
for muscles and for preventing maybe fall even, but not a great sport for osteoporosis, because for osteoporosis we believe in only weight bearing exercises, like you said, like playing outdoors. I'm sure you don't mean playing chess outdoors or playing carom outdoors or playing the Chinese checkers. So if you are outdoors, you will definitely play something where you will be putting weight on your bones, and that is what is going to really help you.
Dr. Roshan, I would suggest Kabaddi because that is a perfect amalgam of aerobics and
Absolutely.
resistance,
Absolutely.
flexibility and balance, mental,
And
physical,
appropriately
everything.
dressed.
Yeah.
And appropriately dressed or undressed.
And appropriately dressed as well.
You have
Yeah.
got
So try
enough
to maintain.
exposure. Enough exposure. Kabaddi players have got enough exposure of the skin.
Dr. Ashish Singh Rajput has a query. He says chronic fatigue syndrome and myalgia. What would be what is your practice regarding vitamin B and vitamin D supplementation in these diseases?
So this is mostly empirical, but I tell you, it's because sometimes it's not possible to, uh, you know, subject every patient to test. Tests are expensive. So sometimes we do, empirically give vitamin D to patients, because I remember one of my colleagues in the hospital. He was suffering from chronic fatigue, which became so bad that he was unable to walk from his room to his car. And his vitamin D levels were measured and they were below 5. He was supplemented and he magically recovered, because your when you are vitamin D deficient, your body is hungry for vitamin D. So normally something which takes 20 days to convert the cholecalciferol into 125 hydroxy vitamin D will be done, accomplished in 7 or 8 days, because the system is just really craving for raw materials. The moment it happens, it quickly does that. So I think vitamin D is a good strategy, for the chronic fatigue syndromes. I often tell my patients, I'm an orthopedic surgeon, and we get patients who have got so-called pain all over the body. So I tell them, if you have pain all over the body, you must rule out five major diseases, and which will cover more than 90% causes of pain all over the body. The first one is diabetes, right? So that way we detect a lot of people who have not been detected as diabetes. Second is vitamin D deficiency. The third we say is the thyroid disorder. The fourth we say is a rheumatological disorder, any kind of autoimmune disease or rheumatoid arthritis, or any such syndrome of rheumatic syndrome. And the last one is the depression. So if you are, sort of anxious and depression, and then you will have pain everywhere in the body. Of course, somebody pointing anywhere in the body with a broken finger will also have pain touching everywhere in the body. In that case, that it's the broken finger which is at fault. But other than that, these five in my practice, I that's what I do. If somebody comes and says I got pain all over my body, and if the husband is with the patient and the patient looks all right, attention seeking, very often than not it will come out to be just a depression or attention seeking behavior. So that's how it is tackled. So vitamin D figures as one of the important causes of aches and pains, although you can have vitamin D deficiency and still have no symptoms. So we must remember that it's not a must that you'll have. So that clinical syndrome may be a little They say that's why it often goes undetected. But once you have symptoms, then you have to. So anybody who's 40 plus coming with, or any age coming with such symptoms, we do look for these.
What you're saying is right. And when we were students, sir, we were taught that if three or more than three organ systems are involved, it's probably a psychogenic cause. But the same is true for endocrinology as well. If three or more than three organ systems are involved, you will think of endocrinology, and that is what Dr. Malhotra has rightly said. And you also have to think of rheumatology. So all these differentials are important.
So I
Sir,
see
in
a
your
question by Dr. Indrajit Singh about the role of injectable erythritol.
yeah, yes,
So the injectable erythritol is for those people who cannot absorb vitamin D, because you see what happens is there are two or three things. One is that the erythritol is often used where it's not indicated. It's used in irrational doses, weekly injections of vitamin D, and they can be very, very dangerous. They can give rise to toxicity. Whatever people say, you should be aware of it. So I just now told you that something which normally takes a body 3 weeks or 20 days to do can happen in less than a week if there's vitamin D deficiency. So where is the need to give injection? If you give an injection, goes as a depot. You may have initially very high levels of the vitamin D, and then they will come down, and they were either irrationally high, and then they start going down and weaning off, and then it will possibly go below the desired levels, and gradually wean off. And I think it is better to go for oral supplementation, which works very effectively. So unless somebody has malabsorption syndrome or problem with the absorption of vitamin D with the oral preparation, I see no indication for an injectable erythritol.
sir. Greetings and salam for you from Dr. Noor Aga Danish, who is connected from Kabul in Afghanistan. So, and he's thanking you for your talk. Questions are from Sunny Grover Sahab. We drink RO water now, treated water at home. So, does RO water have any impact on vitamin D levels?
So it is now being recognized more and more, and it is coming to the light that the RO water may not be the best thing to drink, and it is got because it chelates everything, and sometimes even the essential nutrients like magnesium and all are actually leached out of or filtered out by RO. So currently, I think there is. A narrative which says that RO is not really very healthy, and then you should just use a filter which filters out it looks at the bacteria and not at the taking out the minerals.
Yeah. There is a suggestion from Vinay Gupta ji. He says, a few decades ago, we introduced iodine in salts. In salt, we iodized our salt, and we were able to almost eradicate iodine deficiency. So, sir, any advocacy that you've been doing to ask for fortification of milk with vitamin D or any other foods with vitamin D?
So I was a part of a committee, but then finally this work was taken up by one of my very close friends, General Raman Marwa, and this fortification has been actually accepted by the government. There was a very big hindrance in the fortification of milk, because in India, by definition, you cannot add anything to the milk because there's nothing called an additive to the milk. There's only an adulteration to the milk. So, as per the law, even adding vitamin D amounted to adulteration of the milk. So that
Or
had to
adding
be worked.
water?
Second,
Or adding water?
the yeah, and second thing is that the any of the nutritional supplement can only give a fraction of the RDA. You cannot give the recommended daily allowance just as a nutrition, because you don't want somebody who drinks 2 liters of milk because he's a bodybuilder to get those undesirable levels of vitamin D in his body. So if you look overseas, they supplement this orange juice with the vitamin D. So food fortification is there. Milk fortification has been a challenge which has been accepted now, and we should have that. When I was the president of Indian Orthopedic Association, because of my special interest in bone health, we suggested to the government that if you can distribute iron and folic acid tablets to the community all across the villages, rural and urban population to take care of anemia and pregnancy. Why can't you just distribute vitamin D tablets, just across the community? It is just not going to be a big cost factor here, and that is what I thought at a community level can be done, because we all know a large proportion of our population is vegetarian. We know people don't go out in sun. When you get old, you don't won't go out at all. So I think this kind of very simple measure, where you just give a vitamin D tablet across the community, you know, something like even 400 international units a day, should be good enough.
And we also have days for deworming twice a year. So if we can do
Absolutely.
deworming twice a year, then we can also give vitamin D twice a year, at least in winter, before winter.
Yeah,
So what everybody is saying is everybody saying the same thing actually. Vitamin D should be taken regularly. We should keep our vitamin D levels normal. And Dr. Utsav Sahu, who is a physician from Delhi, he says that yes, like you said, it is impractical to expect that sunlight will give us adequate vitamin D. It's just too hot when
absolutely.
you go out. Sir, a question from pediatrics. Dr. Rameshpal Singh Pawar sir is a 72-year young pediatrician from Saharanpur in UP. He says we give 400 units of vitamin D to all newborns up till the age of 6 months. And after the age of 6 months, we increase it to 800 units. So, any comments from an orthopedic perspective?
So if you look at the ICMR NIN recommendation, even 600 units is good enough after the first 6 months. So what he has been doing is perfectly fine. 400 international units is the recommended amount, and then 600, and the current recommendation is 800 only for people above the age of 60 years. But then it's so variable now, how much it will get absorbed, how you take it also will decide. I generally tell all patients to take it with a glass of milk, which ensures that they'll at least drink a glass of milk once a week, or if they're on supplementation, or at least once a day, because all said and done, the milk is the most natural and the best supplement for bones. Whether it's about calcium, the calcium in the milk is 100% bioavailable. So you take 100 ml of milk, you get 100 milligram of calcium. Period. You take a glass of milk, 250 ml, you don't need a 250 milligram tablet of calcium, and it's natural. The child will make all his bones, and all his bones will grow just based on mother's milk. So the milk is actually, in a country which produces so much of milk. Of course, I'm not talking about the one which is made by the fatty acids and this thing in the local backyard and then sold as milk, and the nakli khoya and nakli milk, which is also rampant in the festive season. But the real milk, I think it's a great nutrition for bones, and that's really unparalleled.
Thank you, sir, for saying that because I'm from Haryana and our state logo, semi-official logo says "Desa mein se Desh Mara." I mean, our state is the best. That we are very clear about that. No offense to anyone else. "Jit doodh
And
dahi ka
then
khana."
you have a lut in your hand in case somebody doesn't agree.
We do have that. So doodh dahi ka khana. So we are the doodh and dahi ka khana wala state. We eat and we drink milk and curd. Actually, sir, about the lut, so this is speaking to everybody who is joined in. Dr. Malhotra is an expert in osteoporosis. So he did research which said that if you have a walking stick in your hand, that is the best way to reduce the risk of falls, and then it is the best way to reduce the risk of fractures. The only problem was that Dr. Malhotra did not do his research in Haryana. Here, if you have a stick in your hand, that increases the risk of fractures. So that is also, sir, about person-centered and ethnic-centered research.
That's right. And then actually it also keeps the dogs away.
It keeps the dogs and the
And
dogs away
that
also.
that also is a risk for fall. The dogs,
Yes.
stray dogs are a big risk of fall with two-wheelers. I have treated too many people and seen too many old people die who their two-wheeler was chased by dogs and they lost balance, fell, broke a hip, and then just died.
Yeah,
So
that is
that's
unfortunate. Yes. Dr. Kamal Kumar Kaloni shares that most probably he would have had very low vitamin D levels. He took vitamin D every alternate day for 1 month, so that is 15 tablets, and then every fifth day for another month, and then the vitamin D level came up to 89, perhaps nanogram, I guess. So he says that in some people, once weekly is not sufficient. So, sir, in your practice, let us differentiate between symptomatic and asymptomatic patients. So,
Yeah. See, it all depends on this thing. You see, the intuitively, if you have established that the patient is deficient and you have supplemented, you should do a follow-up examination of the serum levels. Because surprisingly, I've seen in some rare odd patients, the vitamin D doesn't rise. So you saw the recommendation. This is give again, but some patients will not pick up the levels just by the native vitamin D, and we are forced to give the activated form because and this is a very strange phenomenon in this country. We have also seen patients with low vitamin D and normal PTH. It's not at all uncommon in your if you see in your practice also. Uh, in patients who are like hip fracture, where very low levels and you need to bring it up quickly, we do give it the twice a week, or sometimes I have also given on alternate day. But you see, these kinds of regimes can be validated only if there are blinded studies and control groups. Till that time, the standard recommendation means remains that if you give once a week 60,000 units, it should bring up the levels pretty quickly. And when you are chronically in a state, I don't see a need to bring it up in a few days. Some people will argue that if you give injection, then it is immediately it is given. It doesn't work that way, because you need to convert it. You actually throw a lot of raw material to the machine that also may not always produce maximum end product. So I think 60,000 units a week is normally a good enough substitute or supplementation, which has been recognized everywhere. And like I said, for ease, we say 60,000 once a month. But then the best thing would be something like, a daily dose, because a daily dose, gradual daily dose, it works, gives you better levels. So if you are going to give alternate day, you can do that for your supplementation when your vitamin D levels have become fine. You can give it daily or you can give it alternate day. So you can give, say, 2,000 units alternate day or 1,000 units daily. But I think for supplementation, for 60,000 a week has been shown with studies to give predictable rise in the levels of vitamin D.
So, what Professor Malhotra is saying is true for most patients. And of course, if there is something specific, you have a patient with kidney disease, with liver disease, somebody with the really symptomatic osteomalacia, then of course the person will be in a specialist hands, and then the dose might be higher. And there are social issues as well. A patient might come to you and say, "Doctor साहब, मेरी बेटी की शादी है 10 दिन के बाद, आप मुझे खड़ा कर दो." And the fatigue, there are multiple reasons contributing to fatigue at that time: physical stress, mental stress, and then a vitamin D injection might help uh, in terms of a placebo, in terms of immediate relief. But these would be rare indications. We cannot generalize them.
And then if you can't stand, I think Lut is always of great help.
That's right. Uh, and सर वीव आपसे गप्पे मारते मारते पता ही नहीं चला, एंड विनय गुप्ता जी कह रहे हैं पता ही नहीं चला, संजय मराठे जी भी, एंड आई अपोलोजाइज, सब लोगों का नाम भी नहीं आज ले पाया. वी वर सो एनग्रॉस्ड इन लिसनिंग टू डॉक्टर मल्होत्रा. But let's just reinforce what Daksab has taught us. Vitamin D is important. Vitamin D deficiency is common in India. We can correct it easily. All we need is an oral preparation. And ये भी question raise किया गया, tablet, capsule, solution, all are fine. Now there is something called emulsified calciferol technology. तो ज़्यादातर जो आपको softules मिलेंगे, they will be made in soybean oil. It will be emulsified. It will be stabilized against cold and heat both. So they are all very easy to take. You can take them any time of the day. दूध के साथ ले लें तो अच्छा है, but वैसे भी ले लें तो कोई दिक्कत नहीं. It will get absorbed. So don't worry too much, but do take your vitamin D, and 60,000 units a month, that would be for everybody, including for the elderly. बहुत सारे questions थे. And
If you don't mind, I'll just interrupt. There is one question from Swapnil asking, is there any
yeah.
relation between vitamin D deficiency and allergic skin condition? In fact, there are a lot of skin conditions which are associated with the low vitamin D levels. And allergy, I just told you that the immune mediated conditions often are associated with vitamin D deficiency. During my residency, almost 35 years back, I saw patient of ichthyosis, and they actually are very low in vitamin D. They actually, their skin cannot make any vitamin D at all in the sunshine, but they lose a lot of vitamin D from their body. So, in fact, there is a very interesting book for orthopedic surgeons called Ski Bone. So that is the a orthopedic manifestation of skin diseases and vice versa. And it's called Ski Bone, and it talks about the relationship between skin diseases and orthopedic diseases. Maybe you should read a latest version of that book.
Good idea. And also, while at that, let's all read about Danveer Karan. My city, Karnal, is named after him. Karan had this protective armor. We don't know what it was. When you read the description, it could have been ichthyosis, it might have been psoriasis, it might have been anything. But he was son of the sun god. मतलब sun god के सूरज देवता के बेटे थे वो. So let's think about that as well. And I think another piece of research for Dr. Malhotra to go back and chew upon. What kind of skin condition did Danveer Karan have, and what was the relationship with the sun god? Rashmi Karnawat ji पूछती हैं, sir, one last question if you allow. Vegan fad, more and more people are turning to veganism. Uh, Many of them go abroad. Should every vegan take regular vitamin D and B12 supplements?
Absolutely. They are all deficient in B12 and they are all deficient in vitamin D. See, it's fine to be vegan as long as you can take supplements. So, I believe that you should be careful about these things because, like I said, we always say a vegetarian who doesn't drink milk is worst hit by these disorders, the calcium and vitamin D deficiency. So if you are vegetarian, and which is very common in Indian population, without being vegan, the Indians, there are so many ladies, they are vegetarian. Majority of them are vegetarian. The ladies in our houses. Now the present generation, maybe the newer generation, they are more non-vegetarian, but most of them are vegetarian and they don't like to drink milk. So they don't drink milk. They are the ones which are worst hit by these disorders. So must be vegetarian who doesn't drink milk. I always say is worst hit. And those ladies, young ladies who pursue size zero because to look attractive are also not very intelligent in terms of taking care of their bones because their bones are also very weak.
And it's easy to take a dietary history. Just ask your patient or ask yourself, how much milk do you buy per day? So most households will say, yes, we buy 2 liters, 1 liter, 10 liters, whatever is it. And in how many people is that divided? How many children, how many adults? That will tell the patient himself or herself that the calcium and vitamin D deficiency is there. So they need to fix up the calcium from milk and or supplements, and vitamin D from the supplements that we have. Vidya sir, it's been great being with you. So many things that I've learned from you. Uh,
Learn
India
from
and
each other.
yeah, and Dr. Danish also from Afghanistan. Thank you for logging in, sir. Any last comments from your side before we sign off?
No, thank you very much. We are the orthopedic surgeons with the difference. We don't want people to break bones. We want your bones to be strong. We are not looking for work. Please look after your bones because your bones protect the most vital organs of your body. Remember, whether it's your heart or your spinal cord or your lungs, or they are all protected by this. And if you have a spine, then you have a great personality. That sort of thing. So, so be people with good bones and keep away from orthopedic surgeons.
So have a spine and have a smile as well. Faraz is with us, sir, backstage. Faraz, could you please show a certificate of appreciation for Professor Malhotra? Thank you, sir, for being with us.
Thank you very much. Thanks a lot.
जैसा
Thank
कि
you.
आप सब जानते हैं, हमारा के मेट टॉक्स जो है ये डेली शो है, और हमारा काम होता है, हमारा उद्देश्य है हेल्थ अवेयरनेस बढ़ाना। आपस में बात करके 1+1 11 होता है, ये भी हम कई बार बात कर चुके हैं। हरियाणवी अरिथमेटिक अलग होती है बाकी प्रांतों से, बाकी देशों से। तो 1+1 इज 11 एंड डॉक्टर मल्होत्रा ने हमें इतना कुछ सिखाया। दिस इज अ वेरी इंपॉर्टेंट स्टेप इन आवर जर्नी टुवर्ड्स बेटर हेल्थ। मैं आपके साथ होता हूँ हर सोमवार और वीरवार। मैंने उर्दू भी सीखी हुई है डॉक्टर मल्होत्रा। हर पीर और हर जुमेरात मैं होता हूँ के
Wow.
मेट टॉक पे। एंड आपको फिर मिलूंगा अब अगले जुमेरात, एंड वील बी स्टार्टिंग अ न्यू सीरीज फॉर द नेक्स्ट 3 or 4 वीक्स। इट्स कॉल्ड फार्मा टॉक्स। तो देखते हैं फार्मा टॉक्स में क्या सरप्राइज आती है आपके लिए। वंस अगेन सर, थैंक यू फॉर बीइंग विद अस। वी लुक फॉरवर्ड
Thank
टू
you.
होस्टिंग यू अगेन। जय हिंद सर।
Jai Hind. Bye bye.